Hello everyone. October is recognized as an important month because it is dedicated to raising awareness about the importance of breast health and screenings for the early detection of breast cancers. This annual campaign serves as an important reminder of the crucial role that these examinations play in maintaining the breast health. Breast cancer is the most prevalent cancer worldwide among women, and these examination plays a very vital role in improving their survival rates as well as the treatment outcomes. So let's dig in a little deeper. Why is breast self examination so important? Breast self examination is like a health checkup you do for yourself so that you are able to understand what is normal for your body. By doing this, you will be able to understand if there are any changes or any problems that exist, as well as when you identify this early, you will be able to seek help at an earlier stage and have better outcomes. Early detection. Key word here is understanding what is normal for your body. Regular self examinations will help you become familiar with the normal look and feel of the breast. Many people are diagnosed with breast cancer in the later stages because they don't know much about it. They delay their care or don't know it's a life threatening problem. Establishing an open and trusting doctor patient relationship encourages patients to share their concerns and ask questions. When you talk openly with your doctor, you will know when and how often you need to get mammograms and other tests done. Now, the doctor will be also able to assess a patient's individual risk factors for breast cancer, such as any family history or lifestyle choices, and provide a more personalized guidance on risk reduction and early detection strategies. Breast self-examination has to be done once every month, and the best time would be 3 to 5 days after periods. Breast cancer is more common in women than in men, and in most cases occur in women over 50 years. A family history of breast cancer, especially in close relatives like your mother or sister, can increase your chances of getting it. Also, inherited gene mutations like BRCA1 and BRCA2 significantly raise the chances. Now, apart from these, drinking alcohol, not engaging in regular physical activity, and carrying excess weight, using oral hormones for managing menopausal symptoms or sometimes given to you as birth control pills can also be related. So all of the above can increase your likelihood of developing breast cancers, but you need to talk to your doctor or just leave a query here to get a personalized advice and find out about your own risk factors. The most common first symptom that is typically found is a painless lump or thickening in the breast tissue. This lump or thickening is often noticed by the person during the self-examination or may be discovered by a healthcare provider. Next, look for changes in the skin of the breast, including redness, dimpling, puckering, or the appearance of an orange peel texture. Pay attention to the nipples. Look for any changes in their position, such as turning inward or any discharge which could be clear, bloody, or a different color. Note any persistent pain, tenderness, or discomfort that doesn't go away after your menstrual cycle. Check for unexplained swelling in the breast, underarm area, or collarbone, as this could also be a sign. If you encounter any of these signs, it is important to contact a doctor promptly for further evaluation. Keep in mind that not all breast changes or lumps are indicative of a breast cancer, but it is important to get any unusual findings examined by a healthcare professional. So, what are the steps for breast self-examination? Now, there are 3 important positions that you need to take. The first is in the shower, in the front of a mirror, and lying down. Now, begin by standing in front of a mirror and do the following positions. While doing it, check for any visible changes in the size, shape, or color of the breast or nipples. While in the shower, raise one arm. Start with the right arm raised above your head. This will help you examine the right breast. With your left hand, use the pads of the 3 middle fingers to feel the right breast. Use a circular, up and down, or a side to side motion to cover the entire breast area, including the nipple area and the armpits. Gently use light, medium, and firm pressure to check for any lumps or changes. Pay attention to any unusual sensations and changes. Make sure you have systematically covered the entire breast area. Repeat on the other side. Switch arms and use the right hand to examine the left. Raise your left arm to help assess your left breast. Performing a breast self-examination while lying down is another way to check for any changes in your breast tissue. This position can help you feel your breast more thoroughly. The steps and the way to do it is the same as mentioned earlier. Lie flat on the back with a pillow or a folded towel under the right shoulder and your right arm behind your head. This position will make it easier to examine your right breast. After you have examined the right, switch sides. You will also need to check the nipples for any discharge or changes in texture. To summarize, breast cancer is the second most common cancer worldwide and has become the most leading cause of cancer in women in India. We are now witnessing more and more number of patients being diagnosed with breast cancer to be in the younger age group, in their 30s, in their 40s. In 2020, more than 2 lakh women in India were estimated to have been diagnosed with breast cancer and more than 76,000 deaths were reported. The low survival rates in breast cancer is often associated with late detection, low awareness, presence of a stigma, fear about pain during screening, and fear about the disease itself, lack of screening tests and infrastructure, low literacy, and low income levels. So it is crucial to know that having some of the risk factors doesn't mean you will definitely get breast cancer, and not having them doesn't guarantee you won't. So breast self-examination is considered to be a simple, quick and non-invasive intervention. Performing it regularly once a month helps you know and be familiar with what is normal for your own body. If you notice any changes that we have discussed earlier, it's important to consult a doctor for further evaluation and guidance. Please remember, not all changes mean it's breast cancer, but it's really important to let a healthcare expert check things out and decide. Also remember, early detection and evaluation can lead to better outcomes, provides more effective and less aggressive treatment options. So do not delay your care. Do not ignore any lump or pain. Don't let the responsibilities on your shoulder delay your care. You are important. So let us use this month as an opportunity to learn, share, and take action. By doing so, we not only support the women who are affected by breast cancer, but also contribute to a healthier, more informed, and empowered society. Thank you.